it's 1:30, so I will start our Valley High meeting on September 5th, 2023. Might as well do roll call. Gloria?
Here.
Mike Shorten?
Here.
Earl Kaminsky?
Here.
John Reinert?
Here.
Jim Kearns?
Here.
And I'm here as well. All right. Do we have a motion for the minutes approval? Mike moves, Carl seconds. Any discussion? All right, all in favor of approving the minutes, say aye.
Aye.
Aye. All right, approval all. We're about to have Terry walk in. All right, make note, Terry Greeno is joining the meeting. I don't believe we have any public comment. Nope, I can see there's nobody signed in. All right. Do we have any members' comments? All right, then we will move right on to the Valley High Administrator's report.
All right, wow, that was quick. Unfortunately, this report won't be as quick, because I do have a lot of things that I want to just put on the table for you guys and give you some updates. The first thing, probably the most important of them all, is that earlier this morning we did close a COVID outbreak. So we just had 2 residents, 2 staff, but by definition, 2 or more is an outbreak. That was about 2 weeks ago that those tests came up. We know how it came in the building, so it's pretty small group, but we did have to go into our COVID response for 2 weeks. This morning the health department did close it for us, so we were able to unwind everything, and I know that it changes everything. The minute you tell the staff, hey, we're back in masks, the mood and the demeanor of the whole building just goes right down. I can tell you there was some celebratory around 11 a.m. this morning when I said, hey, you can take them off. So, but we closed that up. Really, it was more asymptomatic than anything. The staff members had symptoms, but once the staff member tested positive, we automatically have to go through house-wide testing. So, and that's where we picked up the other 2 residents. The staff member got at-home tests that they tested positive on. Just so you guys know, in cases like that where we have COVID in the building and it's a staff member test positive, we do pay them their regular wages and not have them use sick time or anything like that. We just consider it, potential occupational hazard, as there's no way to really, it could be raging in the community outside, but there's no way to verify that. So we just handle it from that perspective and move on. So they pass their time up and they come back to the building. Any questions about the COVID outbreak? It's kind of old hat at this point. Pops up, you deal with it, goes away, you move on. It's going to be the long and the short of it. We are expecting in the next 10 days to be new vaccine guidance to be released from the federal government. Basically what it's going to do is move away from the bivalent and back to the monovalent. At least that's what we expect them to do. We're still going to be required to promote the vaccine here at the building, especially with the residents. And I talked to our pharmacist today. We're going to look at doing something at the end of the month once we know what the new guidance looks like. So kind of put that on your radar. Census-wise, last month I told you guys that we had June, July, there was that real lull in overall census. We're back to being full. So everything has rebounded kind of exactly as we figured it would. We're running at about 80 residents, which is where we're going to stay now until we're done with the memory care unit. So we're going to be capped out. And when we start talking about budget here in a little bit, you'll see that all the numbers have been predicated on 80, not 120. So we've kind of adjusted the revenues down to that number, and we'll have to ramp them back up when we finish the project. Staffing is where I want to spend a little bit of time. We are having a little bit of a positive recruitment kind of period or whatever, where we're seeing some CNAs come through the doors. Now that's good news and bad news. Good news is that they're coming our way, and we're able to start getting rid of some of the agency that we're using in the building. The bad news is it's a sign of what's happening around us, which is buildings being sold, buildings being closed, units being closed, staffing being cut significantly, just so that facilities can make ends meet. I put in your packets the state of the sector report from the American Healthcare Association that was released in August, detailing out the total number of buildings that have been closed nationally since COVID hit. We expect that to accelerate with the new staffing standards that are going to be released, that were released on Friday but will get finalized. And that's going to impact everybody down the line. And I'll bring that up here in just a few minutes. Next month, I'm going to be bringing you guys a recruitment and retention plan to try to get ahead of the storm that's coming. Something that I think we should consider is looking at the CNA and the nurse pay rates as they relate to agency rates, not the market rates. So right now, we're chasing the other facilities in town. You know, one raises their rates, then we raise ours, then they raise theirs, but we're still way below the agency, which is where everybody is going to work. We need to look at this in a different way than we have in the past. We are not competing against the other homes in Woodstock anymore. We're competing against the staffing agencies who can hire these individuals on at a higher rate with a no benefit package, and they get to pick and choose their schedule. You know, we have a nurse that comes to us from one of the agencies. She's here 5 days a week. We absolutely love her. She loves us, and every time I talk to her in the parking lot about, hey, when are you going to sign on? She sits there and laughs. She's like, you can't match the rate, and I'm not working weekends. I can't argue with that because, A, if she comes on board, she's going to have to work every other weekend like everybody else, and B, these agency rates they're paying these nurses is $10 more an hour than what we're paying here. We're not in the game. If we're going to try to recruit people out of the agencies to come back onto our full-time staff and save the agency expense, our pay rates are going to have to get up above the market and compete with the agencies. I'm going to put that kind of together for you guys for next month so you can see what those numbers would look like if we were just to go to the high end of the market versus if we were going to try to get to the low end of the agency costs. And then that way we can talk through what makes the most sense. Right now, you're paying the agency rate, so anything below that rate is a savings. The problem you run into is if you raise those rates for the new hires, it's going to rise the tide of all the staff that are currently on staff. So it's not a, hey, we're just going to change the start rates. We got to make sure that we keep everybody with the right separation. So I have not given any of this stuff to Cheryl yet to give her thoughts and her review. I'm still trying to figure out the numbers. And trying to look at some different ways that we can be a little bit more attractive. We need to get ahead of this staffing mandate that's coming down from the feds. And I can talk a little bit about that. We are still trying to get all the details and figure it out, but what transpired over the last week or so is quite interesting. CMS commissioned a study on the correlation between staffing and quality. On Thursday, someone from inside of CMS released the results of that survey. They do not support a correlation between staffing and quality. Actually, it goes down and it talks about not-for-profit versus for-profit having a difference in quality, but there's no magic number, and that's what's in the report. So once that leaked out Thursday morning, we started getting calls from the national level saying, hey, this thing's going to drop. It's going to drop within the next 24 hours because they need to get ahead of the news cycle of the report. So Friday morning, about 8 a.m. our time, that standard proposal dropped. It's huge. So if you look at it from the perspective of mandates, you have what the federal staffing minimums are now, and then you have Illinois, and then now you have this new national standard. So I mean, it's a jump for Illinois, but for some of the states, it's massive. Like put people out of business, massive. So we're going to have to work through what this all means. I believe there was an oversight in the proposal. Some people say it's intentional, so again, this call at 3 o'clock today is going to help try to clear a little bit of that up, but the LPN nurse class has been completely eliminated, meaning that if you, like when you look at the nurse calculation right now, you get RN time and then other license time, LPNs or whatever. Other license time is gone. It's all RN time now. Other license time counts as CNAs, so they've just eliminated an entire class of worker. I think it's an oversight.
I don't understand. Where are they putting them? They have to
Into
be...
the CNA bucket.
Oh, that's crazy.
Again, a lot of this is dust that's got to settle yet. So
Wow.
I'm cautioning that this is a proposal. But right now, if you read it, and the American Healthcare Association is the one that is reading it the same way I am, RNs are, it says 24/7 RN time, and then when you look at the calculations, LPNs are not included. Nowhere are they on there. So the people that feel that it's intentional is that there's been a push nationally for a long time to eliminate the RN class and move everybody into a single the LPN class, move everybody into a single RN class. Is this a backdoor way of doing that or an oversight? I don't know yet. But if you eliminate the LPNs, that extremely inflates your costs Most long-term care facilities,
Isn't that what they did with teachers though recently? They just made teachers test up to getting their teaching degrees.
I'm
I
not
know they
familiar
did
with
it
that.
Real estate brokers, instead of a licensed real estate agent, they just made them all brokers. And just, it was just, if you were in the business for so many days, you just tested right into it. I mean, possibly,
there might be a ramp. Now, there's a 3-year phase into this, so we have time to prepare, but already you're starting to see, this weekend was a flurry of nothing but calls and everything else, because everybody's already starting to think, how are we gonna do this? Right now, nationally, we don't have enough nurses and CNAs to fill the standards that we have in place. To double the standard, or in some cases even higher, where are these people gonna come from? How much is it gonna cost? The current number that is being proposed is $11.3 billion in unfunded mandates per year on the long-term care sector that just got levied. So it's a big deal.
So, let's take like 5 steps back.
Nope.
This is coming from CMS, which stands for?
Centers for Medicare and Medicaid Services. They are the governing body of all of healthcare.
Okay.
Now,
So now, it's possible that this could be pushed back from RNs, because there are a lot of facilities that pay RNs the same as they pay LPNs. And there's been pushback with that forever, and I understand that. So this might be, if it's intentional, it might be a way to put the RNs in a class by themselves so that they can get a higher rate.
yeah, there's could be a little bit of that. I think that there's a lot of it's getting driven by some of the unions. They've been crying for higher staffing ratios for a long time. There's some politics in this, and the part that I struggle with is in no politics involved in this, just a straight up statement. In Biden's speech on Friday, he said if these mandates were in place, we would have saved 200,000 lives from dying in COVID. That leaves the entire COVID outbreak at the feet of long-term care, which that doesn't set well with me. Because I don't think that having higher staffing ratios would have changed anything. But irregardless, those are what we're dealing with right now. In your packets, I tried to give you the full spectrum. I gave you the article in favor of it. I gave you the article from the American Healthcare Association that's against it. So I wanted to try to paint the full picture for you as this starts to unfold and develop. We're going to need to keep this in the back of our minds as we talk about budgeting going forward. Not so much today, because it's not going to go into effect in the next fiscal year, but after that, we'll need to keep that in mind. And we're going to need to keep that in mind as we look at revenues, case mix. How do we establish that? Right now, a lot of buildings across the country are looking at what they have to do in order to shut down wings and things to just stay viable. The part that needs to be talked about at the legislative level, you've heard me say access issues all along about, if long-term care gets bottled up, the whole system gets bottled up. Well, that's what's going to happen here. If long-term care facilities to continue to close, hospitals can't discharge the elderly out of the hospital, which doesn't free up the beds for the younger people. The system does not work without long-term care. It never has, and it can't. So this here is a big concern from not just the long-term care standpoint, but what the impact will be across the entire healthcare landscape. So stay tuned, and I'll keep you guys in the loop as more and more stuff develops with this one, because this is pretty fresh, but this is something we need to have on our radar from now until it is finalized.
The question I have is, so a lot of times I've thought in the past that we go past the standard, right, for staffing?
Yep.
So at what point will you know if you're already meeting the standard that's being proposed?
The first piece is we got to determine whether LPNs count in the numbers, because if LPNs don't count, we don't meet it.
Okay.
We use LPNs.
Okay.
Now, we have 24/7 RN coverage, we have an RN on each shift, but I run LPNs all day long in different different shifts. If they don't count, we're not going to meet that number. I have LPNs in leadership positions in nursing that, again, if all of a sudden they're no longer counted as nurses.
Right.
It's not fair, because I know LPNs that are as good as RNs, if not better, but it is what it is. Hospitals have done away with LPNs for a long time.
Good Shepherd was the first.
Yeah.
So we might have in the future, not right now, we have to look at the county doing something to help LPNs get to RN status then, right?
Yep. already kind of in the, this weekend, every time it would pop in my head, I'd go home, I have a war room in my office downstairs at my house, and I make a quick note. So that's potential and option, scholarships that we can offer to get them through. But a lot of the older LPNs don't,
They don't want to do it. They don't want to do it.
because I've been trying to get a few of my LPNs to RN since I got here. And up until this point, other than there being a pay disparity, LPNs make a little bit less, and the fact that they can't do assessments, there's no difference. So there was no impetus. This could change the calculation, although I can tell you, my leadership one, I think that would be the retirement queue, unfortunately.
Yeah, it's hard for them to do it. Once they've been an LPN, we had an excellent LPN where I worked, and I wanted her to be director of nursing when we had a gap there. But we can't do that with an LPN. She has to be an RN. And it would be very easy for her to go and get that. She wouldn't do it. She's still there, still LPN.
Leaving all that money on the table. But yeah, it's
She
either
didn't want
hand
the
or-
responsibility.
Right,
Yep.
all right, so it might be on the docket in the future.
Oh, it will be.
Discuss.
So I'm going to keep you updated as the dust settles on this one, but just kind of be aware of it and more to come.
Do you have the average cost of what it would cost us at that point to convert up after 3 years?
Not yet. I'm still running very rough numbers, back of the envelope kind of stuff at the moment. First thing we got to figure out is what happens with the LPN and RN. That's got to get clarified. Once I know that, then I'll know how many total RNs I need, and I can start pulling numbers across. So,
But if you were to change your wage to the temp agency's wages, how is that would affect this program?
well, it won't affect this program unless we're talking about numbers, right? If we have to go up higher than where we're at already. So when I pull it all together, I'll try to clarify that aspect of it as well, so we have a full picture to look at. So it just kind of stinks that we're going to do budget just the same time that this happens, so I can't give you that clarity. But the good news is it does not affect this current budget that we're putting together. So we'll just have to keep it in the back of our minds. And then the last thing related to staffing is just kind of a little heads up. We are going to drop from 5-star in overall staffing to 4 stars because of a data glitch in our PBJ reporting. So every quarter we have to submit our payroll-based journals to the federal government, and then that's how they calculate all of the staffing and everything else. On the last day of the quarter, when we were uploading the data, the system went down from we think it might be the county side. We have no idea. And so we submitted all of our data, but we weren't able to go in and clean it up. So I have, I think, 4, if not 5 nurses that show as 0 hours, even though they worked. So it pulls our overall time down. So what does that mean? The way I ran the numbers, I believe we are still over the minimum, but below the 5-star number. So it'll drop for a quarter. That's going to lower our overall score from 5 to 4 because we'll lose the bonus point of being a 5-star in staffing. It's not a reflection of anything we've done here in the building as far as cutting staff, available staff, or anything like that. It is purely the data file that got sent over. We did not have time to clean it up. We actually reached out to the federal government, and I mean, it was the most bold response I've ever seen. No, we'll not open it up for you. Okay, I guess this conversation's over. The way it was explained to us from the Illinois Healthcare Association is if they opened up the portal to allow us to clean it up late, they have to do it for everybody else, and then what's the point of having debt? Whatever. At the end of the day, we're not going to see any fines for it. It's just going to affect a 5-star score for 3 months. So, just make you aware of it, but we'll work through it and it'll correct itself. Any questions on anything staffing related? I know I just covered a ton of ground.
So these CMS standards that have a potential impact, it sounds like it may take a couple of years before it's even required to be implemented. So conceptually, this is being driven by the Biden administration. If you have a change in the administration, those rules could also be affected?
They could.
Okay.
Depends on how they end up getting finalized. So there's this thing called the requirements of participation. And that is what everybody who takes Medicare and Medicaid dollars have to do. And there's a whole laundry list of them. If this gets looped into that, it will be hard for anyone after him to undo it. It's not impossible, and it can be done, but now you're looking at a whole other rewrite of the requirements of participation. I don't think they're putting this into the ROPS, because there has not been any talk about that yet. But again, this is all very new.
Sure. Thank you.
It's a good question, though. Any other staffing related? All right, cool, let's do financial real quick. The first 6 months of the year, fiscal year financial report is in your packets.
Sorry.
And I'll just highlight the fact that we're still trending in the black. And right now, we're looking at $609,834 in the black, which is largely due to the investment strategy that we have. And I continue to throw significant props to both Glenda and Donna for getting us on a path to where we have a steady stream of revenue coming in outside of just what we provide in services. So it makes a huge difference. I don't anticipate that trending to go too far left or right. This is going to be kind of where we end up at the end of the year. We should be in the black unless something unforeseen happens. But no, looking good. Stay on this path that we're on right now. Even despite the fact that we're using a lot of agency staffing, the numbers are in the right direction. I'll just throw this out, when you have an agency nurse that you're paying the premium on, we also need to remember that we're saving the labor cost on our side, which is, if we were a private facility, the disparity between the overall agency cost and your staff overall all-in cost would be far greater. But because of the IMRF and the benefits and everything with the county, it's actually, the gap is not as far as you think. So it's kind of just what bucket does it fall into. So that's the reason why we can still, with the agency use that we have, we can still maintain a movement towards the black. The other piece is that we're still getting the quality incentive payment enhancement on the Medicaid side. So as long as we keep our quality scores up and keep getting that enhancement, that will help offset some of that difference as well. Projects. We've got a couple big ones on the horizon just to keep on your radar. So on October 19th, we are going to shut our kitchen down for 2 weeks, and we're going to replace the epoxy floor. So this is going to be kind of a break it and make it new, but do it with all the same equipment that we have. So what we're going to do is we're going to take all the equipment out, and we're going to have it steam clean and deep cleaned by our staff here so that it's almost new, and we're going to store it. We're going to have a professional cleaning company come in, and actually the cleaning company was like, this place is really one of the cleaner places I've ever been into, but we want to have everything steamed, the walls, everything back to it fresh with a fresh coat of paint. Floor company will come in, put in a new epoxy floor. I think it's like 48 hours before we can actually move the equipment back in, and we'll bring the equipment back in. We're figuring 2 weeks. That might be a little bit on the long side, but better to plan conservatively than not. So what we're going to do is we're going to use this room here as our kitchen. In fact, behind that door is an oven and a refrigerator, and we can cook out of, and we have one across the way. And so we'll prepare the meals, and we're going to do simple stuff. We're going to get away from the fancy plates, and we're going to go to paper. We let all the residents know this today at Resident Council, so this is not groundbreaking news. But we're going to, we'll do a couple catered-in days. So you order pizzas and call it a pizza party. We got everything is covered. So it's not as bad as it sounds when you hear, oh, we're going to shut the kitchen down for 2 weeks. We're not really going to be out of business. We're just not going to be out of location. So we'll be working out in this room right here. We anticipate that being done on October 31st, and we should get another 10, 15, 20 years out of that floor. So it's getting bad in some spots, so it definitely needs to be done. The other project's the memory care project. We have a date, October 2nd. We are looking for the excavating crew to start digging. So we do not have an open groundbreaking yet. We're going to get that all squared away, and I'll let you guys know so you can all attend. But October 2nd is the date where we're looking to put equipment on the grounds and digging holes. So keep an eye on that. From there, things should start happening pretty quick. I did talk to the residents a little bit about it this morning at the resident council meeting. Second floor residents, impact's going to be pretty minimal. Shouldn't really, they probably, other than the banging and whatnot of the demo part, are probably not even going to know that it's going on. First floor, on the other hand, the temporary wall will go up sometime early October, and then from there all the work happens behind the scenes. But we have to move all kinds of stuff into a, nurse call system's got to get moved, all of that to a temporary location and set up, so it's gonna take a little bit of time to prep it before we can really get moving, but then once we do, we're full steam ahead, so. Any questions about projects?
So say it again,
October 2nd?
October, does the actual earth gonna be broken that day?
It's outside Earth, though.
Yep, that's the day that Tom says the excavator's gonna be here. We are,
We need to work on some kind of.
Yep.
Communications.
I did tell him the same thing this morning.
I just writing it down, so we gotta be cognizant of the chairman's schedule too.
Oh, you know what, I didn't even think about that, but you're right. I'll try to get you a couple dates real quick. That way you can get it on the calendar.
The cow date was my first thought, but that won't work because there's a gravel tour after the cow meeting. So perhaps, thinking out loud here.
Yep.
I feel like, right before the county board meeting in October.
Do you know the date? That's all right. I'll just write down October County Board date.
17. Correct, you're right. Is that to the group?
John has verified, so.
5 o'clock, ready, we could have little sandwiches or something here before your board meeting. Could be kind
Are you talking about September or October?
of October 17th.
Okay, I just want to
So
make
they're
sure.
already gonna have broke ground, right?
The ground will be a little bit broken. Yeah, just the outside ground.
If that's what you were headed for, I mean.
Yeah.
All right, I will tentatively pencil that in, and then you and I can work on
Well,
firming
to
that up.
think about it, I mean, yeah, we could have sandwiches here and
Oh, yeah, we can do something.
Does it have to be during the week? Why not a weekend?
will the kitchen be done?
No,
No, it won't be done until the end of October.
actually, that'll be ahead of it.
I don't know
Kitchen-
if the-
Kitchen goes out on the 19th, this is on the 17th, so that works.
Planned it that way.
That works just fine.
Great.
Gotta have food.
We'll have
Like I
a
said, you
kitchen.
said the 20th, my guys might not have been as accommodating. But yeah, no, we can do that. And then, on the 18th, I'd like to invite you guys.
Sorry, October 18th?
Yep. We're gonna do a silver award party in celebration of that quality award. We're catering it in. And so, unfortunately, we canceled the picnic because of COVID, but we now have we lost half of the tent deposit. We're not gonna get that back, and it is what it is. But we're gonna use the money that we would've spent on the picnic to throw a party for the staff for the silver award. So we're looking at a real high-end caterer, nice luncheon for the staff, and then we're gonna do cake and celebrate with the residents in the afternoon. You are all welcome to join us. I will send out a reminder when we get a little bit closer to it and whatnot.
Maybe we could do that. Break some ground and have some cake.
I'm not opposed to that either. Actually, that's not a bad
Well, you
idea.
have a nice crowd for the staff. I don't know. You know, do like a 3 o'clock groundbreaking.
That could work. That could potentially work. All right, you and I will talk. And we'll get a date out to you guys on both of those items. Last item I have for my report, me and a bunch of the team are going to be in Springfield all next week for the Illinois Healthcare Association Conference. Rest of the staff, Tara's going to stay back, so she'll be here to manage the building and whatnot, but it's our annual conference that we attend, and then I will be attending the national conference the first week of October. I'll be gone that whole week. That's when we'll actually get the silver award in hand, so the following week we can show it off. Any questions on anything in my report or anything that I didn't cover?
All right. Then we are on to the routine consent agenda. Does anybody want to discuss 6.1? If not, make a motion I will need a motion. Mike Shorter makes the motion. Carl
second it.
seconds it. This is money. Yes. it
Yeah,
is.
even though it's a reduction, it still involves
It
money.
is money, yes, so we'll need a voice vote. Jim?
Yes.
John?
Yes.
Terry?
Yes.
Carl?
Yes.
Mike?
Yes.
Gloria?
Yes.
And I vote yes as well. Motion passed. And now our budget review, which we will be looking at, it's in our packet.
In the back of that, I put together some slides,
You also
nothing
have it in the agenda.
super fancy, I don't do fancy. There you go. You got it? Thank you. All right. So I instead of us fighting, seeing up on the screen, I just printed out the slides for you in your packet. And I'm not sure how you wanted me to walk through this, so I was just gonna kind of take us through, and you guys can stop me and ask questions as we go. Fair?
Yeah, so, right, it looks like there was only a slight increase to staffing, right?
I don't think that there was an increase in total staff. I think it was just, look, if you look at the
Numbers,
sheet after that.
yeah, it's like
just-
.07, .07 change in hours.
You want to try to explain that?
Well, I don't guess.
I'll give you one shot at it.
That's why I left the very detailed notes on the next page.
Oh, all right, all right. I see.
That's like moved to 1 instead of .97. So we're not really, we didn't add
Okay.
anybody. We kept the same footprint.
Okay. How many positions do we have open, and do we, we're, I know every time,
You said open?
this is like my third year doing the budget for the county, we don't count those, right? Open positions is a special allotment,
We don't count all of them
right,
Too low for value.
for anything.
for anybody, yeah.
Right now, I'm looking, we got just CNAs and nurses, we have 18 between the two of them.
Okay,
And then I'd have to go, I know my staffing report here, I don't think we break down the other departments, but I think we are pretty full. Let's see, 2, 4, 5 more. So what's that? 18, 5, 23 total open positions right now. Some of those are left open intentionally because the census is down right now. We're not wanting to give away the positions, but we're also not looking at staffing them. And then when we ramp up, opening the memory care unit, they're already on the roster. So really not a whole lot of change. Did you want me to walk through it? I mean, I'll spend as much time on you.
I was looking around, because we have many new members to Valley High, so I thought, well, maybe that's good, let you walk through
I'll-
the
I'll-
budget, yeah,
I'll do it quickly. How about that?
okay.
That's good, because I think most of us can figure out the budget when we see it.
Well, and that's why I'm only gonna hit the things that impact it. So, this year, my team and I, when we started the budget, we struggled a little bit with starting with where the numbers would be. And part of it is, there's a lot of unfunded mandates, and a lot of the COVID money, or the CARES money, or the ARPA money, whatever bucket you wanna throw it in, it's all dried up now. So there's no help from a revenue standpoint in regards to that. We're still seeing supply chain issues all across the board. And it's now getting into weird things like medications, over-the-counter stuff that, be available and then all of a sudden it's not. And so our ordering patterns have been a little bit different than they have been in the past. Actually, since COVID started, our ordering patterns have not resumed to what would be considered normal. And then staffing. It's gonna be the single greatest threat to our organization here. All the other things that go on, we can manage. The staffing part is hard to control because it's what's going on outside of these walls. But that's where a lot of focus is gonna be, and we built for going forward. So let's just talk real quick about the challenges, the other challenges. Agency costs. So every year we have to go out and redo the contracts for agency. Those rates are gonna continue to climb, that we have no control over as well. Basically, what they bring in is what we have to respond to. And then the last piece is just this ongoing national healthcare shortage. It affects everything from nurses down to CNAs. We have done very well lately, like I've told you. The other facilities in our area, I think, are struggling to a point where we're starting to see some of their staff migrate over. So the key is gonna be keeping them. Once we get them, and that's the importance of next month's retention piece. So once we get them here, we need them to wanna stay and make Valley High a destination point for both residents and staff. So let's talk about the highlights real quick. This year, we continue to expand therapy programming with the opening of the new therapy space. You'll see in the supplementals that there's two pieces of equipment that we would like to purchase. One is to replace a bike that the seat actually broke off of. It was an exercise bike that we brought over with us from the other buildings, so I think we got our life out of it. And then the other thing is to add the zero gravity track that we did not install when we built the therapy room. We have the beam installed in the ceiling and it's ready to go. We just didn't buy the actual device. Quotes that we got at the time were astronomical, and we just didn't have that factored into the budget. The price, for some reason, has come down significantly since those quotes have gone out. I don't know if that just it was real new or whatever the case may be. So we're looking to get that done. That'll allow us to continue to expand our therapy programming, and that expands our revenue opportunities. Let's see, we did the memory care edition. We've reviewed the capital improvement and asset preservation plan and made some adjustments to that, and Tom Burrows and I are going to take another look at it here in the next couple weeks. And we've deferred some work that we don't necessarily need to do so that it's not a strain on the budget right now. And then you guys have seen the new strategic plan for the next 2 years. That's our, not the county strategic plan, but our operational strategic plan. Things are moving along on that pretty well, so new report card due to you guys usually in your next meeting, I think. And then the biggest highlight for the team, maybe not necessarily for the committee, but is the National Silver Award that the staff won and Tara took care of for us. So what are our goals for next year? I put a whole bunch in the budget, but let's just focus on 2, and that's the monitor and adjust the policies and procedures, and that is in response to the getting away from post-COVID and looking at changing labor force. And there will be some new regulations that are coming out in regards to a document that's called the MDS, Minimum Data Set, which is what we have to do quarterly or more often for every resident in the building. They're expanding that and some of the definitions and getting rid of a section, so there's some changes coming with that we're going to need to adjust and respond to as we learn more about them. And then the most important goal of 2024 is develop the programming side of the memory care unit. So I didn't include them in the budget, but when the time is right, I will bring forward a resolution to create a unit director position, and we have to go out and hire that person well before we open the unit, and then that way we have someone that we can get trained to do train the trainer for the staff development on that unit, and start thinking about policies, procedures, criteria for admission and discharge and all of that, which I have stuff that we can use as a basis, but a lot of it is, let's see, I've been here for 14 years, so about 15, 16 years old now, so it's going to need to be updated. But we have a jump off point. That's going to take the majority, and I know it seems like, well, that's not a lot for 2024, but that's huge. That work is going to take a lot of time to get everybody up and ready to go, so that way, as soon as we get public health approval, we can occupy the unit. Any questions about highlights or goals? All right, let's talk about the numbers, and not actually numbers, but how we approached them. So the way I do the budget here with my team is that we set up meetings that I meet with each individual department head, or if there's like a team of department heads for that department, like nursing, I meet with all of them, and we go through their items. We look at the last 2 years of what we've actually spent, utilization, and we apply any inflationary factors that we're aware of, and we come up with the numbers. So it's done in a silo on purpose, so that way they're not feeling like they're competing against any other department for dollars, and then my business office and I go back and refine it to make sure that all the numbers work. So usually it works out just fine. This year it happened that we didn't have to go back to any of the departments and say, I need to reduce your budget by a little bit, so it worked out good. So we do it from a conservative approach. Revenue this year is based off of 80 beds. That takes into account the 2 hallways that we'll be doing for the memory care. And then we changed our supplemental approach a little bit this year. In the past, we would look at inflationary forecast of food. If it was 8%, we would just put the 8% through as a supplemental. And then if medical supplies we're looking at 3%, we would put that through as a supplemental. We didn't do that this year. We were able to find room to get all of that into the budget as built for the most part. So what we looked at was one-offs, items that we would just be buying one time. And then there was a few items, nurse agency being one of them, that we were looking at having to add some supplemental dollars into. So we talked already about FTEs, a few minor tweaks, but it's relatively the same. Personnel, we've included, or at least the admin side has included all the health insurance, IMRF, so that's all baked into the cake. And this does not, the numbers that you're going to see does not include anything that we decide we do as, you know, as a group with the recruitment and retention increases. So if we decide we have to do a market increase, we will have to bake that in after these numbers. So I just want to make sure you guys know that there's no projections in here for increases for staff other than what the county is projecting across the board. I will bring a different kind of budget with, not these numbers, but a budget with a recruitment and retention plan next month, so you can see what we can look at or consider, and we'll work through that, and then if we have to, we can get it baked in. Any questions about any of the setup?
Just to clarify this, so in this budget is not the plan you're bringing forward for
Nope.
next month?
It's not in there.
So that will be incorporated if we approved it, right? It would be incorporated for the budget being approved in November.
That is the timeline and plan that I'm trying to fit into, yes. Yes. But if we come back next month and we have different decisions that we need to bring it back to November, then we could potentially miss the deadline. So I will get the recruitment and retention plan to you ahead of the meeting. So that way, if there's questions or whatnot, you guys have an opportunity to ask them ahead of the meeting, so that way maybe we can lock it down at the next one, if that makes sense.
Yes.
Numbers-wise, so the revenues are calculated on the 80 beds. Case mix stays the same as the county board approved, just scaled down to 80. So, if we were at 120, that number, 70, 30, 20, or whatever the number breaks out, that is just, we took it as a percentage and scaled that down to where we're at with 80. So it's kind of parity from that regard. We're projecting about 13.7 million in revenues. In this budget, I built in two $10 per day increases to the private resident rate. I'm beginning to think that that is going to be too low, and that we may actually need to raise that a little bit higher than that. But I want to see what the market is going to do at the end of the year before we finalize that. And that's always been a resolution that comes before this body and then the full board when we adjust the rates. So looking at it from a revenue standpoint, the minimum we're going to do is the 210s. We may do more, so that will just enhance the revenue, be icing on the cake. But it was built off of a 10 and 10. Expenses-wise, like I already explained, we applied all the inflationary factors. So we're projecting about a $13.5 million budget in expenses with additional $1 million in the supplemental requests, which are attached. And then supplemental request-wise, do you guys need me to go through any of those, or pretty much self-explanatory? Some of them are in here that we may or may not need to do. Like, for example, replacement of a 40-pound commercial washer. We have one that we're limping along. If we can limp it along for the entire year, we limp it along for the entire year. The minute it goes down, if we have the budget approved for that, then we just go out and buy the new one. So that's one of them. Activity kitchen, refrigerator, and range are getting to the end of their life cycle, but they're still working. So if we don't need them, we're not going to spend that money. We're not looking to replace anything that doesn't need to be replaced, but as part of our capital plan that we have laid out, we do want to make sure that we've accounted for it. So that's kind of where some of these are at. Other than that, supplemental should be pretty self-explanatory. I'll take any questions.
The zero track, gravity track for the therapy room of 200,000, and that was lower.
Yeah, actually, the one before that was over 5.
What's the return on investment for that, Tom? Do you know?
It's not as simple as just saying if you put it in, you get $25 more a day, because it's that whole picture of what we do. But what it does do is it allows you to kind of start to chisel away at the stroke market, post-stroke, people that need to have that support.
Okay, so they can, zero gravity, so they can learn how to walk and such as that. Okay.
Yep.
I was wondering what it does. And
Yeah, that's just one of them.
subsequently-
Yep.
Yeah,
Walking and balance, regaining physical strength. Right now, we can do a lot of that, but the staff member's holding on to a gait belt, and there's a lot of staff wear and tear. This here makes it so that, A, they get even better assistance, and that we can actually dial up or dial down depending on their condition, but no more of the staff having to be involved with potential back injuries and things like that. So I can't quantify the return on investment, but we can know that it will bring in additional revenue.
The equipment on here, the washer and stove, that's what you were talking about earlier in the year.
Yep.
If I remember right, you had mentioned, hey, we're gonna have confession days coming up with, that's the same equipment?
Yep,
Okay.
yep, we're just
I
putting it
thought
into a,
you said, here, go get the new one.
well, we did get a new one.
Oh,
There were two. There was one that was completely down and one that needed some parts thrown at it. We threw the parts and bought a new one.
okay.
So once this one that we threw the parts at goes down, now this is the money to replace
Okay.
that
I
one. So
remember
no,
we had talked
yeah,
of-
no, we talked about that, but when we did that, I told you there was a second one that was on
Right,
the
right,
wing.
right.
That's this one right here.
Okay.
Yep. So once we do that, we'll have two new 40-pounders and then I think it's 25-pounder. If not, it's a 20-pounder. The smaller one we replaced a couple years ago. So all that equipment will be a little bit on the newer end. You know, those washers take a lot of abuse. They run every day.
24/7, right?
Yeah, not 24/7, but let's see, 5 a.m. till, I think they leave at 3 every day. So, and then the last thing is the facility lifts. I just want to bring this to your attention because it's kind of a weird thing. So for those of you that have been on the committee for a while, you know that every year I've been buying 2 lifts and cycling out 2 lifts for the last few years. The company that manufactures the lifts that we have across the entire house has gone out of business. We can't get parts, but more importantly, we can't get batteries. So as the batteries, you know, how batteries lose that chargeability, we're having to cycle lifts out. So we're at a point where we either have to replace all of them or find someone that's got all of these lifts that we can harvest parts off of. So it's time to replace all the lifts. So we already built into the budget replacement money for lifts this year. I've already bought 3 and 3, so 3 totals and 3 standings that should be arriving within the next couple weeks. With this money that I have set aside, it's going to allow us to replace the rest of them so that we're back to having 8 and 8. We won't buy any lifts for 5 years, and then we got to go back to this 2 and 2, right? So you buy 2 lifts every year and cycle 2 out. That's a little bit ahead of the life cycle's more than 5 years, but in order for us to kind of get ahead of it, you pull the 2 ones that have the most wear and tear out, we'll use them for parts, and you put 2 new on the end, and then you keep that like we had before, where we always had new, perfectly operating lifts for everyone to use. This last year's been a little bit rough because it seems like all the batteries have gone at the same time, where we would normally rebuy a whole new set. So we're kind of in this one is one that when you approve it on December 1, the order goes in, because we need those lifts in the building, and they have scales on them and different things that the staff need that we can't replace anymore. So that's the supplementals in a nutshell. Any thoughts?
I should let them go first. Anybody have any thoughts? So, the fact that we're running in the black, does the income, the surplus, then go into the enterprise fund for Valley High?
You know, it's been a couple.
Just curious saying yes.
Yeah, I was gonna say, it's been a couple years since we've been able to do that,
Yeah.
but yes.
So for budget purposes, can they have that surplus money be used for these supplementals, or do we? Because in general, it feels like
Yeah.
that in November we.
They're not competing with anybody, so those dollars they're Valley High, so if, yes, quick answer, if Tom finishes several $100,000 in the black, we can go immediately to the supplementals.
Because you can't mix that fund with anything else.
Just like if it wasn't in the black, it would pull from that fund.
We need to still be.
Can confirm.
Well, so I'm just looking in terms of the bigger picture, which I guess I could ask this question in finance in 2 days. Is, you know, when we come to the budget in November, supplementals across the board are going to be offered to the board to pick from. Not really picked from. You guys tell us what we're going to do. We say yes or no. But, and then we're like, then we talk about the levy. But my contention has been, when we have surpluses, pull for those surpluses instead of raising the levy to cover supplemental costs that are one-time things.
So all the special revenue funds, including this one,
Yes.
are their own, they operate
Yeah.
independent from everything else. So outside of the 10,000 that I have in for the levy,
Yeah.
it's not gonna be part of that conversation.
This is not going to be part of the question of raising the levy.
Because
The
they
overall,
have
the
their own-
overall county levy.
They have their own funds.
Yeah.
Yeah.
Should this add up to that?
We're
Each one
gonna
of
have a
these?
discussion.
I do know that,
Yes,
Should-
yes.
Yeah,
Should
should-
equal all of these added up?
Yeah. Is it
And-
not?
I'm off by $8,000 for some reason.
And so in general, these are all going to be put
Probably
forward,
because I got five.
unless the
fingers
committee
on
says
it.
no. Right?
We trust the administrator and staff out here. These are things that we carry aren't really in a position to say, that's not a good idea. The reality is, we can afford it.
Okay,
I mean, this, sometimes we might challenge those elements, like the staffing numbers.
I think it's off by
I think
$8,000.
it's off by $8,000.
And to your question about the finishing in the black this year and going over to next year, if you just do some quick math, not including the supplemental request for the agency staffing, it's about
That's it.
$400,000 worth of supplementals. So if you're gonna finish 600,000 in the black this year, 400,000 will go to next year's supplemental, so.
right.
This is a 680. My comma made it an 8.
It works.
All right, other questions?
Anything that I missed?
Okay, well then we're gonna need to give a consensus to put forward this budget to go forward. Anybody wanna make a motion? Mike makes a motion, Carl, seconds it. All in favor say aye.
Aye.
All right, so we'll put forward the budget, the really high budget, and then I let my computer go to sleep. I'm pretty sure the next thing on the agenda is future topics.
Old business.
We have no old business. We have no discussion items. Future topics, so we already have that next month we're gonna be looking at, a report on CNA and nurse rates versus agency cost.
It's actually gonna be bigger than that. It's an entire housewide recruitment and retention.
Oh, okay.
There will be a focus in there
Yeah.
on CNAs and nurses, but
Yeah.
this is gonna be for the entire house.
And then, not right away, but someday in the future, we'll have to look at what we're gonna do about LPNs to RNs. We'll have to see the strategic plan report card. Other topics we wanna make sure we cover. Carl?
What are we doing on the parking lot for handicap?
You know, I don't know where that stands. I know that there's been discussions, but I don't know where that stands. And I know I told you last meeting that I was gonna look into it and bring it back to you, and I totally dropped the ball.
But I bet Mr. Hartman might have some words of wisdom.
Well, what we looked at is to continue that arc, can we add a few more spaces? I think conceptually, it looks like we can, we just haven't gone any further in looking at that design.
Okay, well,
When we did
we'll
talk
put
about,
we'll put it on the agenda next month.
Well, I park at the farthest end of the lot today. I think we all should do that.
I park in the back 40. I've got
I did.
a personal parking spot, because nobody wants to park that far up. You know, there was one thing
Yes.
I didn't mention in the budget, but I
Yes.
probably should just mention it. You had been part of some conversation about potentially needing to hire a van driver and things like
Right,
that.
yes.
I did not build that into the budget, because it seems to have resolved itself.
Oh,
For
we have transportation, because yes, that probably should have been a topic on
For
our,
now.
for all along.
That could change, but rather than us doing something that we don't need to do just for the sake of doing it, we're just gonna park that. And if
Okay.
we need it, we'll come back and we'll talk about it.
No
at a different
pun
time.
intended.
Right, yes.
Oh, that would've been great if I did mean it though.
Right. 'Cause, yeah, no, there's large transportation issues in the county, and there was ones at Valley High. But it's okay from now.
For now, it's okay, so I would not worry about it for now,
Okay.
which is why you didn't see it in the supplementals.
Mike?
Just going back to the CMS report, how long is it, and is it something that we as lay people will be able to understand?
This is it. And if you want it, I can send it to you, but I would think that if you really want it, let's wait till the dust settles and something's a little bit more finite,
Sure.
Yeah,
and I will send it to you guys.
I don't think that's gonna happen. I'm willing to take some bets on that.
You know, if
I'll
it
take that
wasn't
back,
in
but-
two State of the Unions and he didn't come out and say it, like give the speech himself, I might be able to get in there on that with you. But
That would be a bad thing. if that
I've seen
goes.
so many industries, though, where they mandate that, but then they make it like a magic wand that you can, an LPN can become an RN real easy.
and I'd be
You
supportive of that.
They did it with truck drivers,
It's
with
the
the
same
commercial
result.
driver's license. If you were a truck driver, you would go in and take a one test. You know, it's like, they really didn't impact the industry all that much when they made those changes. It was all for the new ones starting out, you know, the
And
existing
I would be
ones.
in favor of a phase out.
I could literally see that.
Actually, I'm glad you said that, because I'm an active participant on this call at 3, so I will throw that out there as a potential solution, as a phase in.
I mean, in
Or
every
phase
other
out of
industry,
the
that's
LPN.
how they've done it,
Yeah, I appreciate that insight.
yeah.
All right, so no other future topics, and we're looking for a motion to adjourn. Terry, motions.
Second.
Carl, second.
Carl's